This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, here we are in January, heading to February of 2015. The Governor-elect Tom Wolf takes office this Tuesday. Joining me is the guy we call in to talk about health care, one of our health care experts, Dr. Stuart Shapiro. He's CEO of the Pennsylvania Health Care Association. He's on Governor Wolf's transition team. But you were also on Governor Corbett's transition team, right?
I'm honored to have been on both, and it was a challenging time when Governor Corbett came in, and he faced budget deficits, and now Governor Wolf is also coming in, and the healthcare system is, as you know, in Pennsylvania among the best in the world. But there are budgetary challenges, and it's been a pleasure to work with on the transition team.
Yeah, well, I mean, you know, these are important. We're getting cabinet officers named, you know, even as we speak.
For sure.
They'll probably get a bunch more and getting all the boards and appointments and commissions. But look, Doctor, let's start with this. One of the big issues, senior population. I think now we have the fourth oldest senior population. It used to, or maybe three. We used to be two. I think we're now behind West Virginia and Maine. Is that right? Are we three?
Pennsylvania is second or third, depending on how you count. But the problems facing the elderly for health care are really serious.
Yeah. But that's my point. We got a lot of seniors now, right?
Yes, we do.
Go ahead.
And a lot of frail seniors. Yeah. And a lot of seniors who need care, especially when they're in nursing homes. And it's real interesting. When Governor Corbett came in 4 years ago, there was a budget crisis. We were in a terrible recession. Governor Corbett made health care a priority for the elderly, and he made the elderly and disabled a priority. And as you look at the services for the elderly and for the disabled, the quality has increased, despite the fact that there wasn't a lot of money, but Governor Corbett made it a priority financially, and there were no cuts for services for the elderly in nursing homes. And the quality went up. Now Governor Wolf comes in, and he's facing a $2 billion
structural deficit.
Serious deficit. And during his campaign, he said health care for all Pennsylvanians is a priority, and he included the elderly and the disabled in that. So we're just hopeful, as people who advocate for Pennsylvania seniors, and especially those seniors who are getting care in nursing homes, whether it's on an acute care basis or on a longer-term basis, that he doesn't cut, or the administration doesn't cut any services. But everything that Governor Wolf has said is he is committed to the elderly, and he's committed to the disabled. And we're looking forward to, as advocates for the elderly, working with him to make sure that there are no cuts going forward.
In all the years that you've been on this program and we've done these interviews, I don't think I've ever asked you what seems to me is a simple, logical question. How many seniors are in facilities, nursing homes, and getting out of our population of a little more than 12 million?
On any given day, there's about 90,000 people, between 80 and 90,000 people in Pennsylvania's nursing homes. And if you look at then the personal care homes and assisted living facilities, there's another 50,000.
Right.
And in fact, of those 80,000 people in Pennsylvania nursing homes, about 50,000 of them, a little bit more than half, are paid for by the state and or the federal government. And that's
Medicare and Medicaid,
right. And that's why it's so critical that the state focus on this issue, because quality has improved dramatically in nursing homes. And it's only because there's been money being paid that's, while inadequate, and nursing homes lose money on Medicaid. Their costs are much higher to take care of those on Medicaid than they're actually paid. But they make a few extra dollars on Medicare from the federal government, so they're able to stay in business. But unless those dollars from the state increase, the quality gains are not going to be maintained.
Well, I want to go to a break. When we come back, I want to talk to you. Now, you just raised a great question. How are we going to pay for it? I mean, I think that's, as you know, a central question here. I want to get to that. But the point I would make going into this break is the requirement, the need to go to nursing homes, get extended and sort of this specialized care is only going to increase. People are living longer. The problem's only going to grow.
And the state has to figure out how to do it in the most efficient way.
Yeah. Okay, doctor, how are we going to pay for it? I mean, health care is not inexpensive, as everybody knows.
The state budget, as I said, pays for about half the people in nursing homes. And Governor Corbett has funded it, obviously with the legislature, to make sure that while it's inadequate reimbursement, at least the quality could be maintained. And in fact, 16 out of 18 measures have improved in Pennsylvania nursing homes. And in fact, there's been a 63% increase in the 5-star quality ratings, which are given by the federal government. But like any family knows, when you have to do things, you either have to increase your earnings, call that revenue for a nursing home, or cut expenses. And every family knows this. And one of the problems with the expenses in nursing homes is the crazy tort cost in this state. The out-of-state lawyers, and they're all from out of state. They come from Florida, they come from Alabama, they come from West Virginia, and they advertise full-page ads in Pennsylvania newspapers, inaccurate ads that have been shown to be deceptive and misleading. They play on people's fears. People then call them. They then sue nursing homes or hospitals. And the hospitals and the nursing homes don't have many protections. Doctors today have some protections against what's called punitive damages. And doctors fight 80% of the cases and settle a small percentage. Nursing homes, because there's no protections and because they're afraid of this tort environment in the big cities.
Most of them?
They settle 80% of the cases.
Settle
the exact opposite. And the doctors used to settle their cases. Now they fight them and they win them. And that's what has to happen in Pennsylvania if we're going to, again, reduce the cost. Because right now, about $2 of every day's pay to the nursing homes for the care goes right out their back pocket and into the lawyer's hands. And that's critical because those dollars ought to go to care.
Before I let you go, is there anything coming up, in the legislature or with the governor-elect in terms of health care that you're especially looking for? Are you looking for additional revenues? Are you, Governor-elect Wolf during the campaign was, certainly not talking about diminishing health care. There was none of that kind of I can't imagine the governor-elect, given what, during the course of the campaign, what he said, doing anything but continuing to fund nursing cares and the health care system in our state.
Governor Corbett's Governor Wolf is a very honorable man. And you have to believe what he said in his campaign, that health care for the elderly will be a priority. You have to believe that he's committed to quality care. You have to believe that he doesn't want to see nursing homes move backwards in the care they provide.
Right.
And you got to believe that he will support some tort reform to drive predatory lawyers out of Pennsylvania.
All right, thanks. You're going to come back, and we'll follow this through the course of this year. It's going to be a pretty fascinating year with a new governor-elect. Thanks, as always. Great update.